Outstanding Chair of Trustees. I want to thank you for coming this afternoon on what is the hottest day of the year. But as you've discovered, some of our rooms have air conditioning, but some of them don't, so I'm really pleased that you actually made the effort. ADAS has been supporting people with alcohol problems in Harlow and across West Essex for over 30 years. I was just saying to Robert, I think I researched the history last year for our AGM, and I think we started out in a room in a pub. And it's grown from that little room to what you see here today. We were set up following the closure of the alcohol unit at Princess Alexandra Hospital. The first meeting was in the Stavanger room at Harlow Town Hall. Representatives from health, social services, education, probation, churches, voluntary groups all got together to start what you see here now. Since then, in that 30 years, ADAS has helped thousands of people and their families to deal with their alcohol problems. Our model of using training counsellors and social workers to support our small team of paid staff has proved remarkable in the success that it's achieved. In fact, placements here at ADAS for trainee counsellors and social workers are quite sought after because of the good basic grounding that they get in training. And Sue did training here, didn't you? She did placement here. And we found that with a lot of our counsellors. They've come back to volunteer with us after they've actually completed their training. What you see here today has been achieved through funding from Public Health England and Morrison's. Unfortunately, neither of those people are able to be here today, but Adrian's going to say a bit later about explaining how that came about and the work that they've put in and the money to help us to achieve this. It means that we can offer clients so much more in terms of life skills, because actually coming for counselling and learning how to deal with your alcohol problems is just the start of things. You know, other things in your life are going on that are impacting your recovery, and we feel that we should be there to support those things, like, for instance, IT skills, helping with CVs and applying for jobs online, even ordering shopping. Cooking skills, cooking on a budget is one of the things we're going to be doing, and much, much more. So we've now got the facilities to do that, and the next few months are going to be absolutely fantastic as we get the message out there. That was what today was all about, getting the message out to folks like yourselves about what exactly we do here. I think ADAS is very well known, particularly in Harlow, maybe not so well known more widely, because we do work in Applesford and in Epping Forest as well. So we have outreach workers in Waltham Abbey and out as far as Saffron Walden and the villages. So it is a very wide area that we cover. But we're seen very much, I think, as that doorway next to the Essex Skipper. Ironic, isn't it, that we're next to a pub, but so many people don't realise what goes on here. So today we've tried to give you a flavour of exactly what we do here. So thank you so much for coming along. Robert Halfon, our MP, is here, wants to say a few words. And after that, Maggie Holcoop, the Chair of Harlow Council, is going to unveil a plaque to officially open the building. So I'll sit down and shut up.
In the House of Commons, I think half the problems we have, if you were around, wouldn't necessarily happen. But it is extraordinary what you do here, and I've learned a little bit about it. I have been before, but I just want to, 30 years is remarkable. Starting in a pub is also even more remarkable than being next to a pub, given the work that you do. But it's something special about Harlow. So you mentioned that it's well known to Harlow, but this is, I think this place embodies what Harlow is all about, which is something that is very part of the community and that is helping the most vulnerable as well. And of course I include West Essex in that. But well done to all of you. Thank you to the staff. I pay tribute to everyone who comes here, whether they're clients or volunteers. Some of those I've met today, and I heard a remarkable story from, oh there you are, a lady, Kelly I think, is that right, your name, earlier. So it's clearly inspirational what you're doing here, and I wish you every success, and thank you again, and good luck for the future, and if I can help you in my capacity anyway, I'd be delighted to.
Thank you for Rick Andrews, Public Health England. He's unfortunately unwell today. So I'd like to say a few words on his behalf and on behalf of ADAS, and talk about the project a little bit and to give a few thank yous. So ADAS was successful in applying for this grant back in 2014-15, and it was coordinated by Public Health England for capital investment into drug and alcohol recovery services. There was an eligibility criteria, and you must have a clear recovery focus, and it was the job of our then Chief Executive, Gareth Clement, who many of you know, to meet the following criteria, along with submitting designs from students at Anglia Ruskin University. So they asked us to prove that we could underpin overarching principles of recovery, and our proposal was created to support people who are in recovery from drug or alcohol dependency. They asked us to meet the needs of adults in either community or residential settings. Now clearly we're a community setting, so our proposal was for a recovery-focused project, specifically for adults who are in recovery within the Drug and Alcohol Partnership. They asked us for the needs to lead and informed by carers and service user consultation, so our proposal provided evidence that we responded to the needs of the local population within West Essex. And indeed many of our groups have been created following demand from the service users themselves. The services are local and that they address gaps in local recovery provision. So our proposal was written specifically with the goal of creating a wide variety of recovery-focused groups in the local area. And it was clear that one size didn't fit all, so we've come up with a suite of recovery groups. We had to be jointly owned by the recovery provider and the local authority. So again, our proposal contained evidence to show that it had been jointly agreed by us and by the local authority in which we're based, and that it was part of the strategic commissioning approach of the local partnership. They asked us to provide value for money. So our proposal provided evidence that the project is value for money. Typically, public health figures show that for every person who goes back into work, when they've been claiming benefits or they've been involved with agencies such as ours, the government will save about £25,000 per person that we can get help back into work. I'd like to thank the students of Anglia Ruskin University for giving us the vision of what our recovery suite would look like. And again, there are 3 photos, I think, during this loop that show their vision. And Phil Bradbury, who I'm also going to thank for project managing, has managed to get this room, even down to the clock, pretty much spot on to what the design was. A thank you to Public Health England and to Rick himself for his personal input and assistance to ensure that budgets ran smoothly and that the grant money was paid to us. To the Morrison's Foundation for their support to create the IT suite. Andy Cruz from Innovate Flooring down at the front here, he's donated the floor and his time to fit all the flooring. Howden's Joinery in Harlow kindly donated the kitchens in the training room and supplied the little kitchen in here. Most of all, though, a big thank you to our volunteers. So as I said, Phil helped us run the project and keep the service running to ensure minimum disruption to our clients during this period. Paul Harvey, one of our service users and now trustee, for your time, passion and effort in redesigning and renovating the rooms which are now the IT suite and the family room. To the ADAS staff who ensured that client services ran as usual with little disruption during the renovation works. And finally to the group facilitators and the clients themselves for now attending and engaging in our new group. So thank you to everyone.
Okay, but I'm not really going to bother with it. Because there's only one thing I'm going to mention. I'm so proud that I'm here as Chair of Harlow Council, which is a fantastic place. I was at the Health and Wellbeing launch yesterday down at the Town Park, and we had a lot of people there. We had Youth Council there, and the thing that I'm taking away from that, one of the things, was that the youth, you're going into secondary schools to talk about substance misuse and alcohol, but they now of course know they've got to go into primary level as well, because it starts in that section, and that is ongoing, and I know it's ongoing here as well. But I'm talking about when I walked into this building this afternoon, I found out immediately that there was a lot of love, a lot of support, And the recovery suite is fantastic. The children's therapy, the IT, it's absolutely fantastic. And the love that you've got here, oh, it's fantastic. And the clients you've got are wonderful. And the therapy group is absolutely fantastic. And that got me very emotional because it's a loving group. You've got all your counsellors that were student counsellors, they're now working here, they don't want to go. How many places do you know like that, where you leave and you stay away? You might go back to your friends, but you don't actually come back and stay. And that's what I found here. And it is absolutely amazing. So, thank you. Now, we've got to do the plan. So I'm going to pull it, and it's going to come off. Thank you so much. It's absolutely beautiful.
Well, Maggie, that was so I was touched as well, so it makes me feel quite emotional. I do appreciate, the fact that you've come and spent the whole day with us and you've shown so much interest in what we did. That is terrific. And you know from talking to everybody here how we feel about the work we do and how much, we love what we do. But we just want to say a real thank you to you for coming along and doing this honour for us, because it's really important to us. So you can see how much work has gone into this place. So
It's beautiful.
we are so grateful that you came along
No,
to
it's an
do
absolute
this
honour.
for us. So
I'll
thank you
remember
very
this
much.
visit back my whole year.
Thank you so much. The people who've dropped things to get here and come and see us and to see everything that we've created for our clients. And I'd also like to thank the clients that have taken part today to show everybody else, what it means in real life. So I hope you learned something. I hope you saw a number of sessions that gave you insight into what we do. I'd like to thank our senior team. I'd like to thank Katie and Adrian. Without these two things wouldn't happen here. So I'd just like to say thank you to the team.